For the Dr. James J.C. Cooley Show. It's your life. That's right. It's your life with Dr. James J.C. Cooley.
The Speaker, Leader, Author Boss program is the #1 certification program for women of color. Speak confidently, write effectively, lead passionately, and earn consistently. This program offers you community and opportunity. It's not just a course, it's a calling. Step into your purpose with Black women who want more. Finishing this course is just the beginning. Opportunities and open doors are available upon completion. Don't wait. Sign up now and start to walk in your purpose and elevate your life to the next level.
Welcome, and happy Thursday. I am your host for the rest of the week, while our beloved Dr. James J.C. Cooley of It's Your Life radio show, 2 days until he is installed as His Royal Highness Aniful Kitu, King of the Quasichrome, Agone Quasichrome. Come on, we're going to get it together. We're going to get it right. We are so excited here at the It's Your Life broadcast. And today we have a phenomenal program. You are going to want to tell someone. You are going to want to tag someone. We have 2 phenomenal Black doctors here today. And in honor of Black History Month, we are going to talk about disparities by design. Millicent, by design. Disparities by design in healthcare in the African American community. So let's get right into it and let's introduce our distinguished guests today. One of them is a dear friend of mine for 48 years. And I tell you what, I am so happy to be doing this show with her today. We're having a sit-down conversation today with Dr. Jeffrey B. Hubbard. He's based in Dallas, Texas. He's a concierge medical doctor, a researcher, and founder of Kmeticare. We will explore the origins of health disparities in the African American community. It is by design. Somebody say by design, on purpose, if you will. Dr. Jeffrey Hubbard is a concierge medical doctor, researcher, and founder of Kmeticare, a wholesale wellness ecosystem designed to address medical disparities at the root through education, prevention, and personalized optimal wellness strategies. With two decades of biomedical training and extensive clinical experience, Dr. Hubbard bridges conventional medicine with cultivating informed care and lifestyle-based wellness approaches. His work emphasizes nutrition, detox, innovative equipment, epigenetics, testing, and community-centered education as tools for long-term vitality. Dr. Hubbard is the creator of Kmeticare Wellness Community with a K, and it's a cloud-based digital hub for individuals committed to discipline, accountability, and generational health transformation. Come on, let's give a hand clap for Dr. Hubbard. If you would, give me that drum roll and that hand clap. Yes. And we also have my friend of 48 years, Dr. Angela Pitts. Angela Pitts is a doctor of optometry. And before first grade, little Angela announced to her parents that she wanted to be Dr. Angela. This desire in Angela was reinforced by the medical needs seen in the time that she lived overseas during her preteen years while her parents served as missionaries at a hospital in West Africa. Angela began her professional climb in high school with college prep science courses and decided to pursue the profession of optometry. She graduated from Pine Forge Academy, one of America's only 4 historically Black boarding high schools. And we graduated together in I'll tell you not, but we graduated together. And so we are both very proud of Pine Forge Academy some years ago. We've been friends for 48 years. Don't do the math. Undergrad university, she went to Baltimore, the University of Baltimore, for her undergraduate education. She received her doctorate of optometry degree from Pennsylvania College of Optometry. Her first grade dream became a reality. Dr. Pitts has worked in various areas in optometry and is very passionate about helping people preserve their vision. She educates the masses and helps them see the best ways to keep their eyes healthy. Customized vision care to help individuals focus on what they cannot see. Would you bring our guests to the stage? Dr. J and Dr. A are in the building. Dr. Jeffrey Hubbard and the crowd went wild, and Dr. Angela Pitts. Thank you so much for being here today as our guest on the Dr. James J.C. Cooley It's Your Life show. This is going to be one for the record. And I am so glad that you decided to come to African American doctors during Black History Month, talking about disparities by design in the African American community. This is going to be wow, 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 wow. So, Dr. Hubbard, can you give us a little bit of information about where you went to school and how you came to be the type of doctor that you are, a concierge medical doctor? Tell us a little bit about what that is.
Yes, ma'am. Absolutely. It's such an honor to be here. I'm really excited about this. Let me start by saying that. And I really appreciated the way that you brought the introduction to the table, because this is a perfect segue into what my experience was like. So I went to Florida A&M University. Let me first give a shout out to all the HBCUs out there, since we are celebrating Black History Month. I am a Rattler through and through. And so I started my educational journey there, moving from Houston, where I grew up, to Tallahassee, and really enjoyed that. I stayed and actually achieved a master's degree as well in physiology before going to Southern Illinois University, where I matriculated through medical school. And that was where my eyes really were open to what the full experience of the healthcare system looks like. And I started to notice certain things that didn't sit very well with me. And those were even magnified when I started working at Beth Israel Deaconess. I got the opportunity to live in Boston and to work at one of the Hubbard hospitals. And it was very eye-opening, very, very eye-opening to see what was happening to certain patients that wouldn't happen to other patients. And there's so many layers to unpack here. But that's really why I think this conversation is so valuable and so important.
Absolutely. We thank you so much for being here today. And I am happy to be a part of conversations like this. I think more conversations like this need to be happening everywhere. This show is called It's Your Life, but you only get one life on this side of eternity to spend in one body. You get one body. So I'm so glad we're talking about healthcare today. So my first question, let's jump in right to the controversy of it, to the thick of it. Please explain what the healthcare disparities are in the Black community and why you believe the disparities are by design.
Again, guys, this is something that we have to discuss. We have to unpack this. There's so much going on here. We can't all fit it into this conversation, but let's begin to unpack what's really going on. First of all, there is a significant misunderstanding of what we're supposed to be eating and the nutrition that we're supposed to be consuming on a daily basis, which is the foundation for many of these health disparities and chronic illnesses that we see a larger majority of in Black communities. And there is a love affair, an emotion that we have with food. And I think we need to face it head on and really address it and understand that it comes from a place of trauma. When we were enslaved in previous generations, we found refuge in food. We found refuge in praising the Lord on Sunday. We found refuge in several different cultural things that are still very present today in a very secular and foundational way. And if we can really take a step back and look at this thing in a much larger perspective, our communities are not set up in a healthy way. Actually, they're even unhealthier than any other community in the world, I would argue. And so we really need to put a microscope on why there are no healthy grocery stores and there are food deserts in our communities. Why is everything about a firearm or a pawn shop or a check cashing place? These are things that set up shop in our communities, but are not present at the same level in other communities. And I think that in itself is by design.
You mentioned slavery and trauma, and I don't know about you, Dr. Angela and Dr. Jeff, but I'm amazed at the food that we still eat as a culture from slavery. And so slavery, we got scraps, and we're still eating the scraps of the pig.
As a matter of fact, we made it delicacies. We took it and we transformed lemon into lemonade. Quite literally. And that's something to be very proud of and excited about, but also take into consideration that some of the ways in we did that to make it tasty is not healthy. And over time, it creates these diseases.
Absolutely. So, my next question is, Dr. Jeff, epigenetics and agency. Most people probably don't know what epigenetics means. So, if you would clarify that for us, there is a common belief that illness is inevitable. We think when we get a certain age, we're going to have this, and when we get a certain age, we're going to have that. And if my mother had this, I'm going to have this. And just genetics that are present in families. Illness is inevitable. That's what we believe. We believe it's just genetics that are present in families and racial groups. How does the new understanding of the human body, like epigenetics, challenge this idea? My mother had breast cancer. Does that mean inevitably I'm going to have breast cancer? These are the things that we believe and we just accept as inevitable.
Yes, and I think that it is a misunderstanding of what our genetic makeup is. And that's why I think the conversation around a fairly new scientific topic called epigenetics is valuable as well. Epigenetics basically means that everybody's genes are unique. And I think understanding that genes are the foundational units of our DNA, just so everybody understands. So they're the building blocks, they're the framework for how all of our trillions of cells are working and why which ones do what they're supposed to do when they're supposed to do it. And so you can imagine that if there's something that is in our environment or something in our lifestyle that we're doing that does not agree with personal genetics, that could be the foundation for disease, right? So that's why I think it's so interesting that now this is becoming a topic of conversation, because we can see various different nuance between different cultural, ethnic, and racial groups. But that doesn't necessarily mean I am predisposed to these things. That's what I was taught coming through med school, was that you could look at someone phenotypically on the outside and determine what their likelihood is for developing certain diseases, et cetera. And
That's not true.
That's not true at all. And I would argue that in many instances, if you understand those things ahead of time, you can actually make yourself healthier. So they don't become a problem, they become a solution to understanding how to prevent these issues from happening in the first place. And so if we continue to eat, as you mentioned, a lot of pork, and pork does not necessarily work for our genetics, could that potentially be a part of the reason why somebody develops high blood pressure, type 2 diabetes, high cholesterol, all the building blocks towards accelerating disease and a faster death?
This is fascinating. We're going to come back and we're going to have some questions for Dr. Angela, some questions for both you, Dr. J, and you, Dr. A, together to answer together. And we are so happy to have you here. We're going to take a station break and hear from our sponsors of the Dr. James J.C. Cooley It's Your Life show. We'll be right back. Don't you go anywhere. You're not going to want to miss this.
Looking to advance your education or career while staying true to your Christian faith? At Viridian Christian University, we make higher education affordable, flexible, and accessible wherever you are, cultivating a vibrant learning community where faith and knowledge converge, preparing graduates to fulfill their life's purpose. Whether you're pursuing a bachelor's, master's, doctorate, or honorary degree, Viridian's 100% online programs can fit your lifestyle. Study on your schedule from your home, office, or anywhere without compromising quality or values. With affordable tuition and programs in Christian leadership, business, and theology, Viridian will equip you to lead with purpose in a changing world. Go to ViridianChristianUniversity.com and see how you can join our global fellowship of faith-driven leaders, online and affordable. To learn more and apply, visit ViridianChristianUniversity.com. Viridian Christian University, a unique and dynamic environment for success, empowering leaders of faith.
The James Cooley Show, It's Your Life, can be heard every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth. Life is full of circles, cycles, phases, and stages. It's your choice to ignore them or embrace them. Motivational speaker, author, military veteran, and founder of the J.C. Cooley Foundation, James Cooley, and his guests will inspire and equip you to strive for your own greatness and overcome adversities. Listen to The James Cooley Show, It's Your Life, every Sunday at 6 p.m. right here on 660 AM The Answer in Dallas-Fort Worth.
The Speaker, Leader, Author Boss program is the #1 certification program for women of color. Speak confidently, write effectively, lead passionately, and earn consistently. This program offers you community and opportunity. It's not just a course, it's a calling. Step into your purpose with Black women who want more. Finishing this course is just the beginning. Opportunities and open doors are available upon completion. Don't wait. Sign up now and start to walk in your purpose and elevate your life to the next level.
Welcome back to the Dr. James J.C. Cooley Show. Our host, Dr. James J.C. Cooley, is just 48 hours away from being installed as the new king of Ghana, and we are so excited. I am Dr. Renee Street Toppin, sitting in for Dr. Cooley for the next week, and we have some phenomenal guests. If you just tuned in, we're talking about health disparities by design. By design, that's important. I want you to hear that part. By design in the African American community with Dr. Jeffrey Hubbard and Dr. Angela Pitts. So we're going to start the second part of our show with a question for Dr. Angela Pitts. I want you to tag someone, especially if you know someone in the Dallas area, because that's where this power team is, in the Dallas area. We're also going to tell you how to reach them online. If you have a question, no matter which platform you're on, go ahead and type your question, your healthcare question, whatever type of question you have for Dr. Jeffrey Hubbard or Dr. Angela. Dr. Angela is an optometrist. She's a doctor of optometry. So Dr. Angela, as an optometrist, you often see things that most people don't associate with eye care. How does eye health give us an insight and early detection of conditions like hypertension, diabetes, and even neurological disorders?
Well, I am so glad you asked that question, because there are so many things that we can see that you cannot see as the individual who's coming to get their eyes checked. The person comes to see me because they want to be able to see better, and their only concern is, I want to be able to see 20/20, and what do I have to do for that? And that is important, and we do take care of that. But it is equally important is what we see inside of your eyes when we look. And we can see so much in there. The eyes are the window to your body. We can see if your body is healthy by looking and seeing if your eyes are healthy. If your body is unhealthy, it will show up in your eyes. An interesting little fact: the eyes are the only place in the body where you can actually see blood flowing through the blood vessels without cutting the body open.
Mhm.
And the blood vessels is the highway in our body for that the blood is the life source. And that's what our body needs to be able to live. And it goes through all the nutrients that you need go through the blood. And they go through like a highway system throughout your body. And the biggest blood vessels actually come out of your heart, obviously, because they're pumping. The heart is a pump that pumps that blood through the body. And then as the blood vessels, the highway goes, just like if you think about a highway, when you're on like the major highways, they're like 4 lanes, and then when you get to little side roads in the neighborhoods, they're barely 1 lane or 2 lanes, and that's the way it is in the body. So by the time the blood vessels get to the eyes, the highway is very, very small. And so when we look in the eyes, we see the health of those little blood vessels. So if things are going wrong in the body, they affect those little tiny blood vessels the most, and we will see things showing up in the body before they show up some other places in the body. We see it in the eye before it shows up in the body, because the eye is the window to our body.
That is amazing. And I have known you for 48 years and I did not know that. I did not know that. That is absolutely amazing. Dr. Angela, why do you think there are so few people that are unaware that the eyes can reflect what's happening in the entire body? Very, very few people know that.
Because we just want to be able to see. We don't care about the rest. I mean, we just want to be able to see. So when you go to the eye doctor, you come there because you can't see. And that was one of the reasons I love being an eye doctor. One of the reasons I wanted to be an eye doctor, because it's a profession where you make people happy. When they leave, they come in with a problem and they leave, you fix the problem. And that just makes, it's a really good, feel good profession, because you get to solve a person's problem. And very rarely do you have to give them horrible, bad news. Rarely do you have to say, oh, well, whatever you have, you're not going to live because of it. So it's a profession where we really get to solve a person's problem, and that's all that person cares about is I want to be able to see. And I think that is why they don't really, they kind of cut off the rest of it. We talk about it, I talk to them about it, but as long as they can see, I don't think they really care about the rest.
Wow. Well, one of your listeners, Teresa Knighton, says my high blood pressure was caught by my eye doctor.
Very frequently we catch high blood pressure and diabetes, because very often a person will come to the eye doctor often before they go to the medical doctor. And very often, unfortunately, in our community, we have the mindset, unfortunately, we don't go to the doctor unless we have a problem. So unfortunately, we don't have the mindset of I go to the doctor for preventive. I go to the doctor when I have a problem. So you go to the medical doctor when something hurts, when you're sick, when you have a problem. That's when you go to the medical doctor. You go to the eye doctor when you can't see. And so it's very hard to ignore not being able to see. You may be able to ignore, I got a little ache or a pain here, and you may put off going to your medical doctor. But if you can't see, it's hard to function. So you go to your eye doctor. So very often somebody will come to us, for a basic reason. I can't see. I think I need some glasses. And then we will often find a more significant problem than you just need some glasses.
Now, I'm glad you said that we don't go to the doctor preventatively. And apparently there's a reason for that. So this question is for Dr. Jeff and Dr. Angela. We're talking about trust versus mistrust. There is a deep mistrust of the healthcare system in Black communities, often for very real historical reasons. How do you both see that mistrust showing up today? And how does education begin to repair that relationship? How do we get our mom to go to the doctor? How do we get, the comfortable even going to the doctor preventatively? So I'll start with you, Dr. Hubbard.
The patient-physician, patient-doctor relationship is so interesting to me because it's actually a bit paternalistic, right? You're going into the doctor and the doctor's going to scold you for being sick and give you a medicine to make you feel better, right? Especially if your numbers aren't good or there's something going on that is contrary to you being at your best state of health. So it's a little bit uncomfortable for certain people. They don't like the conversation around their health. They'd like to just, hey, this is what's going on. I'd like to have a solution, which I think is warranted. I think we need to first start to improve that relationship. This notion that doctors are not fun, that they're uptight, that they're difficult to communicate with, that's changing, guys. The landscape is changing. There's a lot of doctors out here that you can really have a great relationship with, and you can be honest with, and you can talk to, and you can build community with, because that's what the doctor used to be in the Black community years and years ago. It used to be somebody who you trusted and who you could confide in, that, hey, here's what's happening with one of the most important and sacred things we have in this life, as you mentioned, Renee, is our health, our life. We get one opportunity, one shot at this, and our body is so important to begin to be accountable and take care of it. So I think that's where the trust is really important. And I think we can do it. I think there's really a lot of new innovations and ways in which you can communicate with your doctor, ways in which you can be intentional about your health. So I'm encouraged, but I do very, very, very well understand why there is an issue with the concern. I'd like to just point out a couple of things before I hand the mic over to Dr. Angela. I hope everybody knows about HeLa cells, HeLa. This is a unbelievable story that is not told enough. And I found out about this when I was in medical school. HeLa cells come from the cervix of Henrietta Lacks. And Henrietta Lacks was a Black woman in Baltimore in the 40s. And she went into Johns Hopkins to find out what was happening. She felt something wasn't right with her reproductive organs, and she got evaluated. That particular doctor took a sample of that cervix, and that has literally, you all, created the entire industry around what we understand about cells and cell function and all sorts of various different. There's no way to even put a tabulation on what this lady's contribution to science has created and profited. And we don't even talk about it. We don't even know about it. But it's those sorts of things that really make me hypersensitive, even from the inside, about what's happening with the history and the circumstances that have happened to Black patients, that have happened to Black communities like Tuskegee, that have happened abroad. There was also a very powerful study that was done on prostitutes in Guatemala, where they were giving them sexually transmitted infections and were allowing them to see what the progress of said disease was. So there is an inherent distrust because of these historical events.
Well, we're about to go to break, but when we come back, I want to ask you about another area of distrust. Now, I have heard that doctors don't make money on well people. They make money off of sick people. So it's in their financial best interest for you to be sick. So when we start moving to holistic treatments, when we start healing ourselves, curing ourselves, so to speak, with natural alternatives, the doctors try to steer you clear from that. So in my opinion, there is a financial aspect to the distrust where people think, oh, you just want to give me that pill because $600 and you're going to make money, or you're just writing that, subscription, or you're just saying I have this and I have that, because there's a financial aspect to people being sick, people having cancer. It's a big illness, is a big money maker. Dr. Angela, can you speak to that when we come back after break? As a matter of fact, if both of you would speak to that, because I think that's a huge area of distrust, because I know you guys are both in some element of holistic wellness. And there's a pushback from our government against, holistic remedies and things that really, really could make us healthy if they would be FDA approved, but we can't get the approval, right? So let's talk about that when we come back. Dr. Angela, just give us a little tidbit. We have 1 minute about what I just said, and why is there that pushback on holistic remedies?
The biggest thing is the pharmaceutical companies and the insurance companies run the medical profession more than the doctors and the professionals that are actually seeing the patients, and that is a huge part of it. Is that we can't do but so much because we have the constraints of the insurance companies. I think
Really?
that's one of the big ones right there. Yeah. Mm-hmm.
Really? Dr. Jeff, can you speak to that a little bit about the restraints of the insurance companies?
Absolutely. So, if you are getting reimbursed for your treatment that you provided, you've already provided said treatment, the patient has given their copay, and now you are trying to get billed through a particular provider, whatever insurance company that particular patient has. And if they decide they don't want to pay, you have to find some other way to make up that money. So there is definitely a lot of stress and strain on that level of the system, right? The clinician level of the system. And why a lot of doctors are moving away from private practice and working in large groups or working for the insurance companies now, so that, hey, when I put this particular code into the diagnostic chart, then I know that Aetna or United or whomever I'm working for is going to compensate me. As a matter of fact, I might already be compensated to a certain degree, and I'm just here because I'm using my credentials to help take care of people.
Okay.
And also it's limiting to the patient and to the doctor, because insurance companies limit who you can go to. And also they limit what we can do as far as treating that particular patient. There's so many limitations that the insurance companies run our profession, and you have to stay within those constraints. Otherwise, the patient doesn't get the help that they need, and the doctor doesn't get the money that they for serving that patient. It's a double-edged sword.
So with you being an eye doctor, do you find that a lot of insurance companies don't cover vision? Do people have a hard
that's
time
true.
getting-
That's true. Yeah, there are a lot of insurances don't cover vision at all. And so that becomes a problem, that people only want to come if it's covered, and if it's not covered, they don't want to come. And then they'll wait until their glasses are broken and falling off their face and they can't see at all before they finally come in. And sometimes that's too long. And if they have any medical issue going on, sometimes it's so far advanced because they've been eyes checked in 5 or 6 years. That's a problem.
Wow.
A real problem.
Everybody
needs to get their eyes checked. A person needs to get their eyes checked every other year, really, every other year, at least, if you don't have any medical issues.
So why do you think that vision and dental are way down the healthcare totem pole in terms of insurance?
Because the perception that it's not as important. It is a perception that it is not as important, and because it's a subspecialty. Eye doctors are a subspecialty. Dental is a subspecialty, and so it does not get the attention that it should. But dental and eyes, if they're not taken care of, can have monumental health problems, not just vision or teeth problems. It's a whole, where our bodies are one. They all work together. Every part of our body works together. And if anything is off in any part of our body, it can affect the whole entire.
Awesome.
As a
Well,
whole, we need to stay on top of preventative care.
Wow, we are learning so much today. Thank you for this education. And we're going to have a part 2. I can't imagine Dr. James J.C. Cooley not wanting to have you guys back, because there's so much more. I have about 15 more questions, but we're going to go to break right now. I'm Dr. Renee Street Toppin, and you are tuned in to the Dr. James J.C. Cooley Show. It's your life. Live your best life in your best body with Dr. Jeff Hubbard and Dr. Angela Pitts, and we'll be right back.
The Speaker, Leader, Author Boss program is the #1 certification program for women of color. Speak confidently, write effectively, lead passionately, and earn consistently. This program offers you community and opportunity. It's not just a course, it's a calling. Step into your purpose with Black women who want more. Finishing this course is just the beginning. Opportunities and open doors are available upon completion. Don't wait. Sign up now and start to walk in your purpose and elevate your life to the next level.
Well, welcome back, and thank you for tuning in to the Dr. James J.C. Cooley Show, where today we are talking about disparities by design in the African American community as it relates to healthcare. So, Dr. Jeff, I'm going to jump right to you. We have so many amazing questions to ask you, and I do not want to run out of time. Dr. Jeff, what steps can healthcare institutions take to rebuild trust with Black patients and communities?
Yeah, I think it's the acknowledgement first. I think sometimes that really starts the conversation off in the right direction, is to just acknowledge that there's been some missteps and that there's going to be an effort to rectify those missteps. I'll take a second just to talk about what I mean in a more real life application. For example, when I was in school, maybe 2010, there was an acknowledgement that there is a different lab value for kidney function in African American or Black patients in comparison to their peers. So now in certain tests, the EGFR test, the glomerular filtration rate, the amount and the rate at which your kidneys make urine is different in Black patients. And that is something that I wonder could be a contribution to why so many of our brothers are on dialysis, right? There's a significant hypertension issue, and those two things correlate directly towards kidneys not working very well and failing. So those are the types of things that I think really can start the conversation in saying, hey, look, we recognize that there's some areas that we could improve. Let's have a conversation about it.
Awesome. Dr. Angela, and you can both answer this question, but Dr. Angela, I'll start with you. Why do you think our healthcare system is still so focused on managing disease instead of teaching people how to understand it in the first place and prevent disease?
The shortest answer to that is money. You kind of touched on that a little bit earlier, because the industry, as you said, as you touched on, the healthcare industry makes more money on sick people than on well people, and there is not as much incentive for a lot of practitioners to take the time to explain and go through what it takes to be um, healthy and be more preventive, to do the more preventive things. It's a lot easier to just write a prescription for a medication and treat it. And the way the system is set up, especially because of the way insurance is, you have to rush people through because you have to see a certain number of patients in a day, and you don't have a lot of time to spend with your patients like you like to. And it just it's a slippery slope that is a very frustrating slippery slope. So one of the things that a patient needs to do is when they go into their doctor, go in prepared with your list of questions that you want to talk to your doctor about, and have a discussion with your doctor. And you need to be in charge of your own health, because our health is our wealth. It's more important to be healthy than it is to be wealthy. Of course, to have both things is wonderful, but health is more important. You can be super wealthy if you don't have your health, you can't even enjoy it. So it's just so important to be in charge and take charge of our own health. And when we go in, we steer the conversation. We, the patient, steer the conversation when we go into the doctor, and so that we can be more in charge of what happens. And like I said, unfortunately, the insurance companies sometimes limit what the doctor can do, but sometimes there are things that the patient needs to be willing to pay out of pocket if it means that I can be healthier. And so often the question is, well, is it covered by insurance? Oh, well, then I don't want it. And so often the answer is the things that make us healthy are not covered by insurance. For instance, certain vitamin supplements and that type of thing, they're not covered by insurance. But the medicines, when you get the illness, they're covered by insurance. And so it's a mindset of you as an individual. When you go to have your health evaluated, you need to be of the mindset, I want to take charge and I want to be as healthy as possible. And so part of it starts with the patient's mindset.
So, do you find that people are willing to spend more money on getting well than being well and staying well?
It depends on the individual. That's varies.
Okay.
Yeah.
Okay. How about you, Dr. Joe? Do you find that people are more willing to invest in aftercare than pre-care, than preventative maintenance?
I'd say on average, absolutely. Absolutely. And this is so vital, this conversation, because literally we're dying from lack of knowledge. And I think if we had more information, if Dr. Angela made a very, very powerful point, guys, if you don't take anything else away from this discussion, please remember that show up to your doctor's appointment enthusiastic, informed, and ready to go. I guarantee you that doctor will have a different level of respect for you and will communicate with you in a different way if you show up and are very accountable and intentional about your health. They have to talk to you differently because you're not going to allow them to talk to you any other way. And so that's something that I think is so powerful right out of the gate, is even if it's just an inquisitive mindset, you want to know, hey, what does this medicine do? What does that medicine do? What things should I be looking out for that would say that maybe my dose is inaccurate, or maybe I'm taking the wrong steps in doing something else in my lifestyle? Show some enthusiasm about wanting to take control and be accountable.
Awesome. So I do not want to miss the opportunity for you to tell us how might medical education need to change to better emphasize health literacy and disease prevention And we have discussed the healthcare system's inability to truly educate people, especially Black communities. I would like for both of you to tell us how Kmeticare addresses that gap and provides support and something fundamentally different than what people are experiencing in the healthcare community.
You want to go first? Ladies first.
I'll just start by saying simply education. It's very, very important to Dr. Jeff and I to educate people, and education changes the picture. If you are educated and know what to expect and know what to look for, you are going to be so much further ahead in your healthcare if you are well educated. And Dr. Jeff, take it from there.
So my life experiences have really shown me that it starts with every individual and household, and that leads into a community. And so that's what Kmeticare is about. It's about community, and it stems from my personal experiences, losses that I have. Guys, I lost my mom my last year of medical school. From what I consider to be preventable illnesses. And, it's a really big decision to continue to go down a path that may not be the best for every patient. So it changed my trajectory because I recognized that my mom was a microcosm of a much bigger issue, is that people were not getting the full scope of what was happening with their system. So they're not aware that these choices and decisions that they make or don't make are really the foundational components of why you're not well. And so all of these conversations around this disease or that disease, I think the bigger disease is we're just not well on a very, very broad spectrum, but in many different layers. And so that's why I think the wellness community that we're developing that allows for us to support each other, for us to learn in a healthy environment at our pace with various different levels of engagement is a really powerful, powerful tool to actualize a health strategy. Not just talk about it, not just have a New Year's resolution, not just say, okay, I'm going to start doing this, but actually have a plan and people to support you along the way, both in a community and from a professional standpoint.
Okay, we do not want to let you go. We're going to have like a 1-minute commercial. When we come back, can you please tell us what upcoming events you have for Kmeticare in the Dallas area online? We're going to get your website address. We want every single person listening all over this country. We have people listening from Africa, all over the world, streaming on 85 platforms. We want everybody to be able to tune into your next event, whether it's a Zoom or a conference call, whatever you're doing. We want to be connected to the education because what you're sharing is not being shared. Right? This is not being shared anywhere in the way that you shared it today. Who is talking about the disparities, the healthcare disparities in the African American community? You are the people that we can trust. You are the people that are having the real conversations that our community needs to know where these conversations are happening. And so thank you for having this conversation on the Dr. James J.C. Cooley Show. But we need to find out how to get in touch with you and how to plug into Kmeticare when this show ends. And we need to be on top of that. We need to follow you on social media. And we need to be able to know what's going on from somebody who's going to keep it real and have some real talk about what's going on with our health. We'll be right back with the Dr. James J.C. Cooley Show. And I want you to be prepared to take this information, take a screenshot, get your cameras out, because we want you to plug in to the next event with Kmeticare. We'll be right back. I am Dr. Renee Toppin, founder of Black Women Who Want More. Women across the globe who are a part of Black Women Who Want More are proud fans of It's Your Life with Dr. James J.C. Cooley. We are also passionate supporters of the J.C. Cooley Foundation Options and Opportunities, the Choice Program. We are whole women committed to experiencing more in life by first becoming more within ourselves. Are you ready to activate your purpose, fully healed, whole, and divinely aligned with your God-given assignment? At Black Women Who Want More Online Christian Academy, you will receive the tools to activate your voice, elevate your confidence, and eliminate doubt. Be more, do more, have more with Black Women Who Want More. Because as Dr. James J.C. Cooley reminds us, it's your life. We invite you to join us on this transformative journey at bwwmacademy.com. Well, welcome back to the Dr. James J.C. Cooley Show. We have been talking about disparities in the African American community as it relates to healthcare. And we want you to plug in to Kmeticare today. If you haven't been to the doctor in a long time, if you're afraid to go to the doctor, if you want to move towards a more holistic way of preventative healthcare, today is your day. How many of you want to plug into Kmeticare? I just want you to write KMC in the chat, right? KMC, and take this information. And connect. If you're going to connect to Dr. Angela and Dr. Jeff, I want you to type the word connect. That way, if you miss something, they can come back on the thread. They can see everyone who is looking to connect with them. So talk to us about your upcoming event. We have exactly 2 minutes. 1 minute for you, Dr. J. 1 minute for you, Dr. A. What's the next thing? Where can we follow you and plug into you next? Tomorrow, Saturday, Sunday.
I want to hand it over to Dr. Jeff since it's such a short time. You take it over, Dr. Jeff.
Okay, guys. Well, I just want to let you all know I've been fasting in honor of my mother. I mentioned that she passed away my last year of medical school. And so I have been doing this annual commemorative fast for 10 years now. And I've learned so much about the human body, about fasting, about detoxing, the gut health that's so important. So many different elements contribute to why we are not well. And I've culminated all of that into an amazing digital wellness community in the cloud. And we invite you to participate in our growing community. For you right now, those of you who are looking and listening, please know that we are opening the wellness community to you all for 30 days for free, complimentary on the house. Come on in, check us out, see what we do, see how we do it. If you like it, awesome. Welcome to the family. If it's not for you, that's okay also. Everybody's not going to mesh with us. But we are a community of people who are focused on holistic health and wellness, and we want to prevent, we want to circumvent, we want to minimize the potential for developing disease and live as long and as healthy as possible. So if that's something that may be of interest to you, we would love to have you join our family and continue to grow. We've got so many different features and elements in our ecosystem. We could have a whole nother show just about that by itself. But right now, we want you to come on in so that you can lift your level of understanding about your body and about what's happening in our healthcare system so that you can be at your best state of health, what we call optimal wellness.
Awesome. Well, it's your life. Live your best life in your best body. I'm Dr. Renee Street, tapping in for Dr. James J.C. Cooley, and we'll see you tomorrow. Have a great day. Live big, be big, think big, dream big, and do big things.
See you guys later.
Doctor.